Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top health news. NMC considering to relax bond policies according to a report. The National Medical Commission is set to ease bond conditions for PG medical students to alleviate financial and mental stress, including modifications to both seat leaving and service bonds. The seat leaving bond imposed to prevent course discontinuation currently carries penalties ranging from ₹50 lakh in Goa and Telangana to ₹5 lakh in Delhi. The NMC has proposed that states, union territories reconsider these conditions, suggesting that instead of imposing heavy financial penalties, students should be barred from state admissions for a year. This move aims to address mental health issues caused by these bonds, highlighted by cases such as first-year MD pediatric students in UP who face significant stress. The Supreme Court has also advocated for uniform bond amounts across states to ease the financial burden on middle-class students. The service bonds intended to ensure doctors work in rural areas for 1 to 5 years post-education presents challenges for students fulfilling these obligations outside their home states. The NMC plans to streamline these conditions, particularly for private college students who pay higher fees. In Chennai, a doctor dies of electrocution while charging laptop in her room. A 32-year-old doctor, Dr. U. Saranidhi, undergoing training at the Institute of Mental Health in Chennai, is suspected to have died of electrocution in her hostel room in Ayanavaram on Sunday night due to a faulty laptop charging cable. The incident came to light when her husband's calls went unanswered. Upon his request, hostel authorities checked her room and found her unconscious. She was rushed to Kilmpong Government Hospital where she was declared brought dead. An inquiry is underway. She had come to Chennai on 1st of May for a 25-day training course at the Institute of Mental Health. A police source reported that her laptop charging cable was damaged. She was found lying next to the cable, which was connected to an extension box along with her mobile phone, laptop and an air cooler. She was declared dead upon arrival at the hospital and her body was sent for post-mortem. The police have registered a case under Section 174 of the IPC and are investigating. Burn injuries on her palm suggested possible electrocution. Health Ministry shares guidelines for heat safety in workplace. As we all like the summer season, it's important to acknowledge that every year temperatures are rising. This year, temperatures have been increasing across several parts of the country, especially in North India. The IMD has issued a red alert for heat waves in Delhi, Rajasthan, MP, Gujarat, Punjab and Haryana. These states are experiencing extremely high temperatures with the mercury touching 49 degrees Celsius in some areas. In such times, it is crucial to be cautious about your health as extremely high temperatures can have severe effects and might even be fatal in certain cases. Extreme heat increases the risk of heat stroke, which is a medical emergency. For those going out to work, it is important to take preventive measures to protect yourself from the extreme heat. Employers should also implement essential heat safety measures at the workplace. The Ministry of Health recently shared an advisory for employers. In a post on X, the ministry emphasized the importance of keeping workers safe with heat safety measures. These include providing hydration stations and scheduling outdoor tasks during cooler hours to ensure workers stay cool, healthy, and productive. It also advised employers to train workers to recognize the symptoms of heat-related illnesses. Longer intense heat waves linked with rise in premature births according to a study. As the summer heat wave intensifies, its impact on health becomes more evident. A recent study has linked rising rates of premature births to intense prolonged heat waves. Scientists from the University of Nevada analyzed 53 million births in the top 50 urban areas of the US from 1993 to 2017. They found that preterm births increased by 2% and early term births by 1% after a 4-day period of exceptionally high temperatures. Each 1 degree Celsius increase above the threshold was associated with 1% rise in both preterm and early term birth rates. The study published in JAMA Network Open showed that younger women, those with lower education levels and minority groups were more affected. Increases were more pronounced for longer and hotter heat waves, particularly among lower socioeconomic groups. The study provides compelling evidence of increased preterm and early-term birth rates due to heat waves, highlighting the uneven distribution of heat effects among different populations. Data from the National Center for Health Statistics and the CDC, covering half of all US births between 1993 and 2017, was used for the analysis. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.